Here we're training adults, so we're looking at adult learning. That's our normal blood pressure range. Adults bring to the training, to the course, their past experiences, past skills, transferable skills from other jobs and certificates that they've done. 90? 90? Yep, okay. Our model here at Worley is that we have a training centre where we do theoretical and practical training, and then we go into the clinic.
Folks, today we're going to learn about venipuncture. That's taking blood out of somebody. I've been asked to come over today to work with the students doing the bachelor course and in the bachelor mock clinic, helping them doing suturing and venipuncture. So we get our patient to stick his arm out if we've got taken bloods for to send away to pathology.
The scenario is someone's just seen two cars crash. There's no extra help from doctors, and you are it. Okay.
My babies.
Hold it. So they're getting a broad range of experience and a broad scope of practice, because that's what they have to be able to do at the end.
You've seen that she is diabetic?
Yeah.
So now what does
Albert, he's in his second year of his training, so he kind of knows what to do.
Going by a chart there, looks like... Yeah.
Normally what happens is we look at the patient's file first. So I go through with the trainees and ask them, you know, like, what observations do you think we should be doing in this consult before they come in? So then when they are in the consult room, then Albert already knows what to do.
This way, Lee, take a seat.
This is Albert, he's one of our trainees. Is that okay if he sits in this morning?
Yeah, that's fine.
Albert, can you start doing normal obs?
Sandy, we know that Angie's got chest pain.
Yeah.
So when we take Angie into the treatment room, what do you think we should do?
Okay, according to CARPA, I'd like to give her 300 milligram of aspirin.
With the discussion with Sandy today, we worked together to make sure that we're up to date with the evidence-based medicine, and that's what our CARPA manual's based on, and that's the clinical tool that's used in the Territory for all rural and remote services. Even though we know that she's got diabetes, personally as an Aboriginal and Torres Strait Islander doctor, I feel it's incredibly important to offer that upskilling and ongoing learning, and it's a dual process. It's not just a one-way street, it's a reciprocal relationship that I have with the health workers.
Just like a podiatrist or a doctor or a nurse, health workers are now required to be registered. The majority of our health workers at Wuchopperen have provider numbers, which means they're allowed to invoice Medicare for services delivered.